Thank you so much for joining us for the first pet parent webinar in the PetSure Paws and Learn series. I'm Danny Houlihan, Chief Veterinary Officer at PetSure, and I'm your host and moderator for today's session. Tonight's webinar on COVID-19 and pets is brought to you by PetSure and Dr Michael Linton. PetSure is a company of animal lovers, providing a sense of security to pet owners through pet insurance. PetSure powers the insurance propositions of many well-known brands, including Woolworths, RSPCA, and many others. Additionally, PetSure has revolutionised the claim experience with the development of Gap Only. If you'd like to find out more about PetSure or Gap Only, please visit our website. Before we begin, I'd like to run you through some housekeeping items. The webinar will run for about 45 minutes, followed by a 10 to 15 minute question and answer session. On the screen, you should see a control panel to your right. If you experience any problems during the webinar, please submit your issue within the question panel and I'll try and resolve it for you. During the webinar, all phone lines will be muted to reduce background noise. If you have a question for the presenters, please post your question in the question panel. The speaker for tonight's webinar is Dr Michael Linton. Michael is a recognised feline medicine specialist and has worked in both referral and general practice since graduating in 2006. He received qualifications as a feline medicine specialist in 2018. As part of his training, he undertook an original research project on a unique disease known as feline gastrointestinal eosinophilic sclerosing fibroplasia and has become a world leader on the subject. He's passionate about all things gastroenterology. So without further delay, I'd like to hand you over to Dr. Linton.
Thank you so much, Dr. Houlihan, and for the lovely introduction. And thank you to all the attendees for coming along. So, as we all know, in December of 2019, the world seemed to change a little bit for all of us. Human cases of pneumonia of an unknown origin were reported in Wuhan City, in a province in China. Shortly after, a new coronavirus was identified as the causative agent by the Chinese authorities. Since then, human cases have been reported almost in all countries of the world, and it's been declared a pandemic by the World Health Organization. It's led to a disproportionate amount of deaths in some regions. In addition, we're now starting to see some further impacts of the disease, such as collapse of some of the world economies. So, to get a bit of a better understanding about coronavirus, we need to actually have an understanding about what a virus is in the first place. So a virus is a submicroscopic infectious agent that replicates on the inside of all living cells of an organism. They're made up of something called DNA or RNA. With coronavirus, this is actually made up of RNA. And so mainly I will be referring to RNA viruses. Once the virus penetrates the host cell of a human or an animal, the viral genome is unpacked, leading to a hijacking of the host cell's division machinery. And when infected, a host cell is forced to rapidly produce thousands of identical copies of the original virus. So then, if we look at specifically what is coronavirus, coronaviruses are quite common in animals and humans. The origin of the term corona actually means Latin for crown, and it's derived from the plasma or aura that surrounds the sun and the stars. So you can actually see here, if I can put on my mouse, that this is an electron microscopy of coronavirus, and it's got this little aura around the side, around the envelope, giving it its name. They're large, they're roughly spherical, and it consists of something called a viral envelope, which is around here, which has a whole lot of important proteins stuck in the viral envelope wall. Probably the most important protein that you might be hearing about every now and then is something called the S protein, the spike protein. And this allows fusion between the virus and the host cell, essentially allowing the virus to actually gain access to the host cell. So it's important to know that when we're talking about coronavirus, that or COVID-19, that we realize that it's actually part of a big family of coronaviruses. And so it's really, and that's quite important to understand, because when you take your pets to the vet, for example, there's a chance that your vets are going to diagnose your pet with coronavirus. And it's very important to realize that that does not necessarily mean that your animal actually has COVID-19. So what it is the coronaviruses as a whole family are divided into a number of different genuses called the alpha, beta, gamma, and delta coronaviruses. So for example, in dogs, there are two known types of coronaviruses. There's the canine coronavirus, which is the member of the alpha family of coronavirus, and there's a canine respiratory coronavirus, which is a member of the beta family of coronaviruses. And ultimately, all these different viruses are related to each other in some way or another. So when we're talking about COVID-19, we're actually referring to a member of the beta coronavirus group. And this coronavirus has been labeled SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. You'll hear the terms SARS-CoV-2 and COVID-19, and these two terms are often used interchangeably. They don't exactly mean the same thing. Essentially, COVID-19 is a syndrome as the SARS-CoV-2. So I guess for me, it's analogous with say, for example, the HIV virus causing the syndrome of AIDS. I won't go into this too much because I've touched on it before, but again, how does coronavirus infect a cell? What it does, it binds onto the walls of the host cell, onto special receptors. These special receptors are something called ACE2 receptors, which are, and this is quite important because really it seems like the coronavirus, or the one causing COVID-19, has an affinity to bind to these receptors. And it's only in the animals with these specific receptors that appear to be infected. In addition to that as well, the location of these receptors impacts the clinical signs that are actually shown about the animal. Okay, so now let's have a look at the history of coronavirus. And this is the in general of the coronavirus family. So in the 1930s, some poor little chickens developed some pretty severe respiratory signs. They were coughing, they were wheezing, they had terrible mucoid discharges coming from their noses, and some young chickens actually died, at a very, very high mortality rate. And some older chickens, also got sick. They developed some kidney problems, and egg-laying production was severely affected. 6 years later, this virus was actually cultivated, but they couldn't tell exactly what it was, but they named it avian infectious bronchitis virus. And they developed a vaccination, and what they found is in unvaccinated animals, 100% of animals actually got sick from the virus, and mortality was up to 60% in unvaccinated animals. We moved forward 10 years later, and in mice, the mouse hepatitis virus was identified, and a transmissible gastroenteritis virus was identified. And then 20 years later or so, on opposite ends of the world, so I think in Chicago and in London, the common cold virus was identified, thought to be different types of viruses. And then a few years later, again in London, a Scottish virologist named June Almeida from the St Thomas Hospital, through a process called electron microscopy, was actually able to show that both the viruses that were identified in people were morphologically related due to their distinctive club-like spikes, which is what I spoke about before, the spike protein. Not only were they related to each other, but they were also related to that previous bird virus, the infectious bronchitis virus, again from the spike-like proteins. They were also able to show that these were similar to the mouse hepatitis virus and transmissible gastroenteritis virus, and hence the name coronavirus was given to these guys. So if we look at the origin of coronavirus, it's really quite interesting. The ancestors of coronaviruses in general were thought to have existed potentially up to 55 million years ago in the prehistoric age, which is quite fascinating. What we find is that bats and birds, as warm-blooded flying vertebrae, are the ideal natural reservoir for the coronavirus, which is a little bit of a problem because these these species essentially fly throughout the world, and so leading to spread of coronaviruses in general. So now if we get to a little bit more specific about SARS-CoV-2 or the COVID-19 origin, there's two schools of thought. One school of thought is that it's come from a non-human to a human, and then and in the non-human it was already a virulent virus, already causing quite a problem. Or the other school of thought is that it was not a particularly severe coronavirus. It's then been transferred over to people, and in humans it's actually mutated and then become quite virulent in how we know it today. Immediately after the SARS-CoV-2 genomic sequences were first described in January 2020, after the coronavirus outbreak, multiple labs around the world performed extensive comparisons of this new coronavirus that was identified with previously seen coronaviruses. And what they found was with the new coronavirus was identified, it was most similar to previous coronaviruses identified in bats in the past, and also to a similar coronavirus that was identified in 2003. I think you guys may all remember the SARS outbreak. I guess given the similarity of how it was to the coronaviruses in bats, this is where the speculation has come that the virus originated in a bat, and there's thoughts about the various wet markets and so forth that way, and that's why they're going down that path as the potential origin of the coronavirus. So now coronavirus, if we look at transmission of it, and this is, in truth, about just the general family of coronaviruses, not specifically related to COVID-19, it's thought that it can be transmitted through either aerosol, fomite, or the fecal-oral route. The human coronaviruses tend to infect the epithelial cells of the respiratory tracts, while animal coronaviruses generally infect the epithelial cells of the digestive tracts. SARS coronavirus, for example, infects via an aerosol route mainly. And again, it seems to bind to the liners by those ACE2 receptors that I originally brought up earlier. So coronavirus in people, the clinical signs in people really is affected by the type of coronavirus and also the person, the individual infected if they've got other conditions. So for example, signs can really vary. They can be extremely severe, minimal clinical signs to none at all, to really severe clinical signs, such as we've seen with SARS-CoV-2, where you get something called a pneumonitis and a respiratory failure. In animals, again, the clinical signs of coronavirus really affects which type of animal is infected, and also what the specific coronavirus that infects that specific animal. So I'm a feline medicine specialist. I deal a lot with cats, obviously, and I see coronavirus quite frequently in cats, and usually it just causes a pretty straightforward diarrhea. But in some cats, the coronavirus can actually mutate and can cause a horrible syndrome called feline infectious peritonitis, which in the past has been, almost a death sentence for these poor cats. What's quite amazing now is that there is recently a treatment that's come through, allowing us to treat these little guys with some pretty good responses as well that's been seen in the published literature. So the question is, can animals be infected with SARS-CoV-2 or COVID-19 as we know it? So we know coronavirus in general is very good at infecting multiple species. We only have to look back at the SARS outbreak in 2003 to see that experimentally we had monkeys, mice, pigs, chicken, guinea pigs, Syrian hamsters, and cats being infected. In natural conditions, in the field, cats were infected by that SARS outbreak, by being in close contact with people. What we're seeing with COVID-19 at the moment is that there does appear to be evidence that animals can be infected with COVID-19. But the good news of this evidence is that the numbers appear to be reasonably small. So from when I last checked, I think something like 7 million people had been infected with coronavirus, where you probably only got you'd have to say less than 100 or so documented cases in animals, perhaps a little bit more, but certainly not nearly on the scale that people have been infected. Now that could be for a couple of different reasons. It could be because maybe they're not showing clinical signs, or maybe we're not testing animals and we're just not seeing it. On the right of the screen that you'll see, I've included a link to a paper, which I'm going to speak about mainly, but shortly. But that's talking about the prevalence of coronavirus in cats in Wuhan, where there was, that was the initial epicenter of the outbreak. So the clinical signs in animals of COVID-19 are really variable. We can only judge it on some experimental studies that have been performed and the limited number of animals that have been naturally infected. But what we're seeing is that it's a combination of both respiratory and gastrointestinal signs. So respiratory being coughing, laboured breathing, sneezing and nasal discharge, and some of the gastrointestinal signs include vomiting and diarrhea. Like with people, an elevated temperature has been seen. These signs aren't specific for coronavirus. There are a lot of other conditions that can cause these clinical signs. So as vets, it's important that we're ruling out some of these other causes as well. So now what I'd like to do is speak about some of the experimental cases of COVID-19 in animals. And ultimately, the experiments have been performed, really so they can try identify vaccination for the condition, also work out treatment and try to get a bit of a better understanding about how the condition is actually spread amongst animals and within species and to other species. And what we're seeing is that cats become infected, they get a little bit sick but not too bad, but they can certainly spread the disease. Ferrets become unwell and can transmit the disease. Dogs can become infected but don't really become sick and don't pass on the disease, and Syrian hamsters can be infected. We don't know whether they can pass on the disease. So I'll go specifically and talk about cats a bit more. So there was two bigger studies on the prevalence of SARS-CoV-2 in cats. So one of them is from Wuhan, and what they did is they checked for antibody titers in these cats, which would suggest, exposure and the body forming an immune response against the coronavirus. And what they found was that 14.7% of cats living in that highly, the highest of epidemic region, essentially showed an antibody response to the coronavirus, suggesting that they were infected. Those animals that actually lived with people who were diagnosed with coronavirus actually had higher antibody titers. In contrast to this, one of the big labs, IDEX, did some studies on cats and I believe dogs as well that had a combination of respiratory signs and gastrointestinal signs. And out of 4,000 animals, 0 animals actually came up positive for the coronavirus. Now, it's important to note with that particular study is we don't know with those cases whether those animals actually ever had exposure to coronavirus, as opposed to the study from Wuhan. Pardon me. If we look at experimental infections in Syrian hamsters, what we can see with these guys is that there was a study which essentially gave them viral challenge, contact transmission as well. And what they found that was tissue that was harvested for histopathology. So that means actually looking at the effect of the virus on the body tissues. They also checked for viral load and antibody titers as well. And what they found was that these little hamsters could be infected by COVID. They had laboured breathing and weight loss. And the histopathology showed extensive lung damage and what's called apoptosis, which is breakdown of lung tissue. There was very high viral loads, not just in the lungs, but also the spleen and the lymph nodes as well. The good news is all of these guys recovered. There's been some good experimental infections in ferrets as well, and they've done a couple of studies on that. And pretty much what both of these studies that I've included have shown is that ferrets can transmit the conditions amongst them, the disease amongst themselves. So what would happen is you'd get some ferrets that were naturally infected, experimentally infected by a high viral load. Then they would introduce some ferrets who had no exposure in the past to the coronavirus and were symptomatically free. And what they found is that all ferrets who had exposure, to the other ferrets actually ended up developing the clinical signs of the disease. The viral antigen was detected in the lungs, in the nasal turbinates, and also in the intestines as well. What they found, which was, I guess, similar to what we're seeing in people as well, is that before these ferrets showed clinical signs of disease, they had very high viral loads and were also able to transmit the infection. And I think this is what they've seen with people as well, is that before the clinical signs are seen, it appears that disease is transmissible in an earlier place. Again, the good news is, although being quite sick, all ferrets eventually recovered, which is positive. When there's a whole lot of experimental tests that often get produced in the media and so forth, and I've actually referred to some of them. And I guess I bring up this slide because I think, as sort of members of the public, it's important that whenever we read about some of these studies, we sort of critically evaluate them and assess them. And the reason why I say this is there's a few problems that we're seeing that are coming out. So some of these studies that are being released are not peer reviewed at the moment. So what peer reviewing means that you get, once a study has been produced, you have other members of the profession reviewing that study, checking the methodology, the results to make sure it's all sort of true and proper. In many instances, this process hasn't been undertaken straight away, and the reason is because of the fast sort of moving nature of this pandemic. As much information as possible has been produced and to try and get it out in a timely fashion. But this does, pose some ethical questions about how much can we actually rely on these results if they haven't been properly critically evaluated. It's also important to realise that some of these studies that have been produced only, have very few animals. One study that's been talked about frequently in cats, which show that it's very transmissible disease amongst this species. They only initially had 3 animals, and they included another 3 animals, and that got a lot of attention in the media. As well as that, it's important to realise that not what we do in an experimental setting does not necessarily correlate well with what happens in the natural environment. So what happens in the experiments is they're essentially, inoculating a relatively large amount of, virus, say, for example, straight up the nose. That's not to say something like that would happen in a natural setting. Similarly as well, these animals are in, special ventilated rooms really to potentially expose, to contact with the virus. That being said, it's probably a timely, point to move on to some of these natural infections that we're seeing at the moment. So if we look at, the cases that have been seen, the first cases, the first animal that came out was a dog in Hong Kong, and I'll speak about that animal shortly. But in New York, 2 cats were identified. This is in a natural environment. 1 cat was living in a household where someone was coronavirus positive. The other cat was not living in a household where the person was coronavirus positive, but they had outdoor access, and apparently in that particular region, there was a high amount of coronavirus positive people. Both those cats showed mild clinical signs of, respiratory disease primarily. The good news is they both recovered, within 10 to 14 days, so that was really positive. In Hong Kong, where the first dog was identified, this was interesting because what happened in Hong Kong, when people were diagnosed with coronavirus, they were recommended that the animal actually enter, quarantine in a special sort of government-run quarantine facility. And what they found in this particular facility were 2 dogs and 1 cat were eventually infected with coronavirus. 2 dogs really didn't show many clinical signs. I believe the 1 cat again had mild respiratory signs that resolved. But notice one of the dogs that was infected, I believe, was a little Pomeranian, and when it was when that dog was when that dog was released from the quarantine facility, sadly 3 days later, it actually passed away at home. And the cause of death was thought to be related to a cardiac disease that it had, but it never actually ended up having a post-mortem or anything like that. So I do, speculate and find it a little bit strange that it did pass away sort of 3 days after the quarantine facility. But again, I think that's purely speculative, and I don't think we can draw any major conclusions from that. There's been a case in Belgium where 1 particular cat, I believe the owner was in Italy. The owner developed clinical signs, came home. The cat showed clinical signs of getting respiratory. The good news is the cat made a improvement after period of time. Cases have been reported in Russia, Spain, Germany, and France. This is as of last week, and I'm sure since then there's probably a couple of other cases that have certainly popped up about. So in the media, there was, this was quite interesting as well, and it got quite a lot of attention. Some zoo animals actually came up positive with the condition. So this was at a zoo in the Bronx in America. So essentially 5 tigers and 3 lions eventually tested positive. They showed respiratory signs of disease. So the what happened was out of those that tested positive, 4 tigers and 1 lion actually developed clinical signs. These animals were in a very stable population. From my understanding, they never had respiratory clinical signs in the past. And it was found that they actually had exposure to a zookeeper who was actually infected with the disease. The good news is all those animals actually improved with time, and none of them passed away or anything like that. This does pose some questions, though, about coronavirus with the potential risk for populations of wild animals, specifically wild cats, and endangered species down the track. I guess that obviously raised concerns as well. Similarly as well, the grade 8s, have a very, very sort of similar genome to people, and so they're certainly concerned about the risk of spread of coronavirus from humans to the grade 8s, and especially with some of those animals have very much endangered populations. Over in the Netherlands, in mink farms, which they're actually closing down, which is obviously a good thing. I believe they use minks for fur. What they found on, well, initially it was 2 mink farms, it ended up going to 4, is that they had a higher death rate in a period of time where animals showed respiratory and gastrointestinal signs. Signs appeared to be worse in pregnant animals. And it was found that the coronavirus, so COVID-19, affected some of these animals on these farms. The thought against spread was from the, I'll use the terms, one of the keepers to the minks rather than the other way around. At one stage, they did speculate that the minks maybe gave it, to the people who were looking after them, but I believe this is thought not to be correct. But there's also thought that there has been spread among some of the minks on the farms itself. So the big question is then, which animals should actually be tested for coronavirus 19 or SARS-CoV-2? As I said earlier in the discussion, the clinical signs for coronavirus are not specific for coronavirus. So as vets, we've been advised that if an animal, for example, comes in with a respiratory disease, before we go straight to making a diagnosis of SARS-CoV-2, it's important that we rule out other conditions. But once we do that, the thought is that if animals fit certain groups, then it's warranted to potentially test for the condition. So, for example, animals with a close contact with a person, and I think if we only have to look at the natural infections to see where they're getting some of these criteria. So, for example, if we look at animals, one of the criteria is animals in a close contact with a person with suspected COVID-19, where the animal is showing clinical signs. So that, a good example of that, it was one of the cats from New York. Then we've got animals with an exposure to a known high-risk environment, i.e. where there's a human outbreak has occurred. Again, we only have to look at, one of those cats in New York who lived in an area which had a high population of people infected by the condition. The third criteria is threatened, endangered, or otherwise impaired animals in rehabilitation or zoological facilities, again, with exposure to people with SARS-CoV-19 or other animals. So this would be similar to the tiger scenario. And then animals in mass care or group settings, such as a shelter, boarding facility, animal feeding operation, or zoo, such as the minks. So any animals fitting those criteria when they're showing clinical signs, they're the animals that we're, I guess, particularly focused on potentially doing testing for. But the thought is that, we've been advised as veterinarians to try to limit our testing. I think largely because, we want to make sure the majority of the testing, reagents and so forth are used for people. rather than animals. But if appropriate, certainly we do have access to that. So another question is there a risk of zoonosis? So zoonosis means, is the disease transmitted to humans from animals? The good news is, currently as of today, there appears to be no evidence that pet animals are involved with transmission of SARS-CoV-2 to humans. The main risk of COVID-19 is from humans is spread amongst humans to humans. Again, this could change with time, but this is what the current research is suggesting. What we do think is maybe fur may act as a fomite. So what that means is that, say, for example, someone with SARS-CoV-19 could cough on their pet, that could go on the pet's fur, and then if someone else was to pet that animal within a limited amount of time, and then put a hand in their mouth, for example, well, that could potentially be a method of spread of disease. Now, again, that's never actually been proven yet or anything like that, but that's certainly thought to be a consideration. So now, if you look at the impact of the COVID-19 pandemic on pets, we have to look at a number of things. And for me, I've sort of divided it up in the good and the bad. For me, the good is that you can certainly see through this pandemic, with people staying at home, perhaps the human-animal bond has increased. Animals, I think for all of us, we all know how important they are for mental well-being, and I think they've helped a lot of people through this scenario. And certainly, if you've been isolated at home, you haven't been able to go to work, haven't seen your friends, I think it's been an absolute blessing to have animals, to keep you company and get you outside for walks and things like that as appropriate. Adoption rates from some of the shelters has significantly increased, and that's good and bad, which I'll speak about in one moment. But then I guess, if we do look about the bad, there's something, what I term unfounded zoonosis. So I have had questions from some of my clients who, often had elderly or sick people in their household saying, do they have to rehome their pet animal, during this crisis, because they're worried that potentially their pet might spread the disease to, one of their loved ones. Again, there's no evidence to suggest this. Some of my colleagues have actually had people ask them to euthanize their pets, which was completely a horrible thought, based on just complete fear. And then there's this concept of opportunistic adoption. And I think this comes from the idea that, often there might be a spike in adoption through, Christmas, and then, a month or two later, these animals are getting rehomed because people then realize how much work it is to look after your pets. I don't know if that's been proven true, but, so far from my discussion with the shelters, it doesn't look like animals are getting returned or anything like that. So thank God, and hopefully that stays the same that way. We've heard some horrible, situations about an increase in domestic violence through this period, sadly through, because people are at home in smaller spaces, which is obviously no excuse. But the concern is that it's, not only for humans, but animals could potentially be impacted by that as well, which is, horrifying. And then, one of the big things is, we spent all our time with our animals at home. A lot of people have adopted these new animals, but now we've got to go back to work because, things are, appear to be returning to normal. And then what happens to our pets, who have been so used to spending, literally all hours of the day with us? And this can create a problem called separation anxiety, which I'm going to go to a bit into detail shortly, just with a little bit, but I won't go into too much detail because another veterinarian, Dr. Kirsty Seckle, is actually presenting on this for you guys in a couple of weeks' time, and she's a fantastic behaviorist. So the next question, this is for animals, living with COVID-19 and increased home time for people. I think in general, our animals have been absolutely over the moon that we've been at home a little bit more, but it doesn't always, that doesn't always apply. So I'm sure in the audience today, we've got probably a mixture of dog owners and cat owners, and I'm a cat and a dog owner, but I certainly know when I move, a chair or a bit of furniture 30 degrees in my house, my cat will spend 2 days looking at it, seeing what the hell is going on with that. And that's actually quite important because animals can get stressed about changes in routine, and that can actually lead to conditions. So cats can get urinary problems if they're stressed, for example. So what I advise people to do is, at home, is try to, make sure you're structuring your day. routine is important not just for people, but for animals as well. So you need to make sure you stick to feeding times, exercise times. Also make sure your animals have got safe spaces. When we're doing, your various Zoom meetings, or when you've got kids around the house, animals need to sleep a little bit, and we need to make sure that they've got time to actually get away and sleep, get away from what's going on. With cats, I would advise that you give them little hidey holes. And also make sure that things like children are supervised around pets, especially if they're spending time at home and people are busy on Zoom meetings and so forth. One of the biggest reasons we get bites is actually from a disturbance by the family member in the home environment, which is just something that is faced. We've also got to ensure that there's environmental enrichment at home, and I'll talk about that in a moment. The big question is, ultimately what happens when we return to work. One of the big conditions that we get concerned about and that we want to avoid is something called separation anxiety. This is mainly seen as a problem in dogs, but I wonder if it's also a problem in cats as well. They just don't show as many clinical signs that dogs would. But it's a term that's used to describe a dog's distress and destructive behaviour when they're left alone, or even when their owners start to prepare to leave the home. It can include urinating or defecating in new places, escaping, digging, chewing, howling, barking, and pacing. To reduce the risk of this happening, I think one of the things is that and I touched on it on the slide before, we need to make sure that there's a little bit of separation of our pets and ourselves during this home time. So you need to condition your animals to thinking that time alone can be positive. So things like various enrichment methods. So you can put a little bit of there's various sort of puzzle toys you can get, which has got food in it, and animals can spend hours around trying to knock out the little bit of food from the toy, and it's actually stimulating for them to do it. And they can also realize that you don't need to be around for them to have a good time. It's as I said before, making sure they've got a good time enough time to sleep during the day. Animals in some instances sleep up to sort of 15, 20 hours a day, and it's important to let them do that. Just because you're at home, it doesn't mean that they still need their sleep. It's very important. And there is such a thing as too many walks. Most dogs maybe need between 30 to 60 minutes of aerobic exercise a day. We don't want to overdo it. Make sure you spend time, invest time into training them as well. But I think the critical thing is just making sure you've got a little bit of set times apart. So start off with 5 minutes apart, 10 minutes apart. Make sure there's rooms that perhaps they don't have access to, so they don't become completely reliant on you. And again, Dr. Kirsty Secker will be talking about this topic in a couple of weeks' time. So I urge you all to join up to that. So one of the big things for me, questions I get asked is, how do I protect my pet through this COVID-19 pandemic? I guess my feeling about that, it's not so much, as far as we know, the effect of the virus on the animal. Numbers just appear so small at the moment, to effects on cats and so forth. And, again, the majority of animals seem to recover quite well. But it's more so, I look at it as the effect of the pandemic on the animal. So one thing I say to people is make sure you've got 2 weeks worth of provisions, being food and medications. During this period, some medications have actually been harder for us to come by because, they needed to use it for people, which is perfectly understandable. At the same time, I think it's important to try have 2 weeks worth of important medications. I use the term 2 weeks because that's about the quarantine period that, people are often taken out of action. And that's really important. The question is, should animals be allowed out of the house, or to interact with other animals during this period? Really hard question. I guess the general consensus from the, for example, one of the disease control agencies in the States was that, they shouldn't be. I think that's, in practice, it's quite difficult. Certainly, I think if someone's got COVID-19, they should keep their pet isolated from other animals. And especially cats as well. And the other thing is, if you happen to develop COVID-19, reduce contact with your pet, and I'll speak to you about that in a little bit more detail in a second. It's really important to keep the household clean. Coronaviruses are usually quite brittle. They're envelope viruses, so they tend to respond quite well to most of the disinfections around the house. Whether it be bleach or some alcohols as well. Studies have shown that the coronavirus can live in, in and on the environment, for periods of time. That really, how long they survive for really depends on ultimately, what the conditions are, the temperature, but also what the surfaces are. So they don't do very well on cardboard, for example. They only survive, something like 4 hours or something along the lines that way. But on other surfaces such as plastic and stainless steel, they can survive, at least 3 days, it's thought. The impact of COVID-19 on vets, this has been quite a challenge for me. As I work at a reasonably busy hospital in Sydney, and what we've had to do is we formed a team structure or system where ultimately, because if some of our staff get sick, we've got or quarantine. We've got to make sure the hospital stays open. We've also had a situation where we've been sharing our resources. So there was a period that our ventilators were loaned out to the hospitals. They were never used, thank God, in the end. But that it was ready to go. And we had to think about some medications. There are some medications we couldn't get hold of during this period, and we also had to think about rationalising the use of our personal protective equipment, especially again because the human guys needed it. Certainly in the early stages. And then as I mentioned before, the critical thing for us is protecting our staff, clients, and patients. Got a little video here which I'm going to start it off, and I'll run through it with you. So this is at our hospital. We had an outdoor waiting room. I'm going to have to speed it along because it looks like we're actually running out of time. But this is a client coming along, with a pet. Unfortunately, sound's not working, so I'm going to describe what's happening. You can see the pet's having a sniff of the floor. But what happens is you'll see she gets to a sign, and on that sign it says, "Please ring reception." And what we're trying to do here is actually limit the client staff direct interaction or communication. It's sort of like almost like a curbside service or a valet service. So what will happen is this is our receptionist taking the call. She's actually getting an idea about what's wrong with the pet. So then we can send out one of the nurses for triage. And I'm just going to fast forward because again we're running out of time. And so now she's paging out the back to get one of the nurses to, she's going to give them a description about why the animal presented in the first place. And so this is one of our nurses coming out. And so ultimately she's asking the owner questions. She'll be asking questions to the owner like, do you have any respiratory signs yourself? Have you been exposed to COVID-19 or anything along the lines that way? And then of course she'll get an idea about what's going on with the pet. You'll see she's got a lead in hand, so she's going to get the owner to take off the collar because we don't want anything like that to potentially act as foam ice for our staff. So she's changing that. We'll keep moving through. Oops. There we go. Come on. So now she's taking the doggy inside. We'll keep moving along. Just changing all the collars and everything. So now she's gone into one of the consult rooms where she's going to do a triage. So, you can see the good news is this dog doesn't look too sick, but obviously if the dog was sick, this dog would probably be taken straight out the back. And ultimately she's going to wipe the dog down, again, to reduce the risk of possible fomite. And then she takes out the back, she puts in a little holding cage, triage cage. About the time that the animal came in. And then this is Grace, one of the vets. So she's now getting a handover from the nurse. She'll examine the dog. And then once she's examined the dog, she will phone the client and, then give her recommendations and so forth that way. So, which, really leads me into this slide here, which is getting your pet to the vet. The idea is that, this is sort of these non-contact vet visits where you drop the animal off, things will be done over the phone, your pet will be examined out the back. There's also telemedicine as well. So certainly for some conditions, for example, if you've got a relationship with your vet, you can phone up and say, look, my dog's lame, for example, can you give me advice? And your vet will, ask you, advise you whether or not you need to come down, or they might be able to give you some advice on how it can be treated at home. Again, there's a little bit of legalities to this, so it's important that you do have a relationship with your vet. You can't just ring up any vet and get advice, because they do have to have examined your pet within a period to be able to give you information over the phone. Oops. So then the question is, should I avoid contact with my pets or other animals if I'm sick with coronavirus? Pretty much exactly the same recommendations are given for the spread of SARS-CoV-2 amongst people to your pets as well. So the recommendations are, if you have COVID-19, avoid cuddling, kissing, or sleeping, with your pet in the same bed, or feeding, from the same food or anything like that from your pet. That's really, really critical. Make sure you wash your hands. There's thought that 20 seconds of hand washing can actually kill or it breaks down the envelope of the coronavirus. So that's really critical. And then, the question is, ensure your pet does not go outdoors until we know more. I think that's especially important for cats. It has been shown that cats can transmit the virus, amongst themselves and so forth that way. So that's really, really critical, at least for the early period while you've got it. And obviously that, if your cat shows clinical signs, you'll need to contact a vet. It's important to have a plan in place in case you become unwell or need to go to the hospital. So that goes back to this sort of whole 2 weeks, have an emergency kit, have a list of things to do, medications times, that your pet is due for medications, food times, the amount as well, walk times, have a plan for any, foreseen events that could happen. So if your vet's got a particular skin problem or something like that, have a contact number, for your vet's dermatologist. So then the person looking after the animal, can go straight that way, rather than, so there's always an action plan in place. The question is, should you have your pet at home, or can you put it in boarding? Can you have a friend or someone else look after your pet? That would, I guess, be ideal. What do I do if I'm in quarantine or self-isolation and my pet is unwell? Well, by law, you can't break quarantine, so that's important. But if your pet's unwell, contact your vet. There's mobile vets visits that can be performed. Sometimes, if your animal is sick, then, your animal can be picked up and brought down to the vet clinic. You'll find that the majority of vets, especially your local vets, can be extremely flexible in this situation. And, your pets are, the highest, priority for vets and, and our staff as well. So, things can be made to happen. So I wouldn't stress about it or anything like that. Just make sure you communicate and contact your vet. And then what should I do if I think my animal is getting the virus? Again, contact your vet. It's important to book an appointment rather than just showing up. Make sure you tell your vet in advance if your animal's been exposed to COVID-19. And of course, if your animal's showing any signs of illness. They'll likely investigate for a number of diseases, but ultimately, if they feel it's warranted, they could potentially do the test for coronavirus. So for me, I guess there's potentially a few unanswered questions. I think, in people, it seems like people that are immunocompromised certainly have an increased risk of, getting quite sick from the disease. I don't think we know enough in animals about immunocompromised animals, how sick they can get from the disease. There was that dog, for example, that died from just after quarantine in Hong Kong, and I just wonder if could we see a similar, I guess, more severe effect of something like coronavirus with some of our elderly patients that have a number of comorbidities. So that's a possibility. And then I guess there's always the question about zoonosis. Can it potentially be spread to people? At the moment the information says no, but it's something that's always on our mind, and we've always got to keep an open mind to this, because that could have some heavy consequences. So the Australian Vet Association, which is our governing body, has some advice to owners. The good news is they don't believe there's any evidence to suggest you can get COVID-19 from your pet. Keep your pets as part of the family unit. Plan for your pets in case you need to go to hospital. Practice good hygiene around the home, and then review advice from your vet clinic before any visits. Thank you so much, everyone, for giving me the time to have a chat with you. I'm more than happy to answer any questions or anything like that. And it's been a pleasure talking to you all. Thank you so much. I'm going to hand it over to Danny Houlihan.
Perfect. Thanks so much, Michael. And so we do have some questions from the audience. So the first question is, have you performed any tests for COVID-19 on pets within your practice?
Yes, we have. We performed it on 2 cats, which came from coronavirus exposed household? The answer was those cats, they had respiratory signs. Both cats came back negative for the disease. Prior, unfortunately, we only had testing available to us, I believe, from May, and I'm sure in April we had 2 cats as well, which ended up, having clinical signs of it, which never got tested at the time because it just wasn't available to us. And I've got a few colleagues in other veterinary hospitals who have tested for it. It's all come back negative so far.
Great. And then the next question is, do you think that COVID-19 will continue to influence the hygiene protocols in vet practices? And this attendee has indicated that their vet's been asking them to wait outside for all of their appointments until recently, where they're permitted to bring 1 person into the clinic.
Yeah, that's a really good question. I think as a society, I think our hygiene has improved a lot. I didn't mention at our hospital, for example, we've got this bell that goes off every half an hour requiring all of us to wash our hands. It's literally this alarm, and every half an hour we have to wash our hands. And I think as a society we've become, developed a far, better understanding about hygienic practices and so forth. Do I think it's going to maintain at vet hospitals? No, I think with time, you will see that your vet hospital will open up their doors a little bit more. One of the critical things that vet hospitals, like many businesses, face is that they've got a responsibility to look after your pets and the concern, and their staff as well. And the concern is that if members of staff become, unfortunately, sick with the coronavirus, and then they're forced to, just because of quarantine, in general, in a vet environment, we all work pretty close together with each other. So if one member of staff becomes sick, there's a chance a number of members of staff will at least be exposed, and that could take them out of action. So what your vet hospital is doing is really trying to limit, I guess, the chance of, one, their staff being exposed, so limiting any risk of anyone getting sick, but also trying to maximise the chance that the hospital won't ever have to close down. So then, they can continue to look after your pet. Now, I do think with time, restrictions will ease off, but, I can see we've just started opening our doors to our clients, and now we've got these big plastic, I guess, see-through things. So when you're speaking to our receptionists, there's almost like a plastic barrier in front of you. So, they're not getting any, you can see them, but, there's no risk of exposure to, any respiratory secretions or anything like that. Similarly as well, what we're doing now that we've opened up a little bit more, is that we're limiting our, discussion times with the owner. So we're not examining the animal in front of the owner. We're taking the animal out the back to our procedures area to examine, and then we're having a chat with the owner. But yeah, in a roundabout sort of, long way, yeah, I do think it's going to improve with time, but it might be a little bit longer.
Thanks, Michael. And then the next question is, do you think we'll continue to see more dogs and cats being diagnosed with COVID-19 in the coming months?
Yeah, I think that's a really good question. I've got to look, fortunately, I feel like in Australia, and let's, hope this remains the case, it seems like we've dodged a lot of bullets in this country. And so I think the chance of, a number of cases coming, out of Australia are probably small. But yeah, I do think we're going to get, cases pop up, more and more overseas. Again, the big question, that I ask is, are we not seeing cases of COVID-19 in animals because they're just not getting it as much, or is it because they're just not showing as many clinical signs, or are we not testing enough? Now that tests are becoming more and more available, perhaps to the human population, there will possibly be a little bit less sort of, I guess, easing, because we were really advised, only test if we really feel that it's appropriate to test. But I think, once there's more reagent and so forth available and there's more testing, we'll probably pick up more infections.
Great, thanks, Michael. And then the next question is, are there any other common viruses that people get that they can transmit to their pets?
Yeah, that's a really, really good question. So the answer is yes. There's a number of viruses they can get. So, and again, there's coronaviruses, different to this current family. There's a series of worms that can get, and it's often thought that animals give diseases to people, but it's often the other way around. There's a number of respiratory infections that people can get, so something called Pasteurellis and Pseudomonas, I believe, where there's transmission both ways. I would have to double check that as well. But yeah, absolutely there is. And I think, you know, probably the critical thing about it all is that just practice good hygiene. You know, a lot of these conditions, you know, or viruses will die with, you know, good hand washing and things like that. And I think that's just critical. So, you know, when you're petting your dog, or your kids are petting your dog or your cat, wash your hands after. You know, make sure they're not eating in the same area as you and things like that. You know, when you pick up the droppings, ideally, you know, use gloves, wash your hands after. And I think a lot of those practices actually go a long way to reduce the risk of transmission.
Perfect, thank you, Michael. And then another question, which you've given some handy hints on, is how do we go about transitioning a dog once we start going back to work? Dogs are used to having their humans home now, and so when their humans leave the house, they do become anxious. And so for the attendee who asked that question, we do have a webinar coming up with Dr. Kirsty Sexel, as Michael indicated before. And she's got 2 webinars that she'll be presenting, including one on helping pets avoid separation anxiety. So, go ahead, Michael.
Yeah, I mean, that's what I was going to say. I think, you know, Dr. Sexel will be amazing, you know, to answer that question. But yes, certainly, you know, I think little things like from now, you know, you can start, get your pet used to being separated from you. You know, start with 5 minutes, 10 minutes. Also, some of the things like, I know, for example, with my own dog at home, like when I go to work, I just have to pick up the keys and the dog knows what's happening. Try to break that sort of, you know, cycle a little bit. So for example, you know, pick up your keys, put on your work clothes, but then sit down and watch TV, or, you know, sit down and, you know, eat breakfast or something like that. Try to, you know, break the specific cues that your animal might, you know, anticipate that this is happening. In addition to that as well, make sure, you know, give your animal things to be occupied with, which doesn't necessarily involve you being there. So there's a whole lot of puzzle toys and things like that where, you know, animals can have mountains of fun doing. You know, they can spend hours trying to get little biscuits from these little puzzle toys, and, you know, they realize that you don't have to always be the center of attention. You know, life can be good, you know, without you. And sometimes I think we want our animal to think that we're the center of attention because we love it, but at the same time, it does have negative consequences.
Perfect. Thank you so much, Michael. So thanks once again for all those questions. Unfortunately, we're out of time today. Thank you all again for attending the webinar. We hope you've enjoyed the session. A very special thank you to Dr. Linton for putting today's presentation together and for giving up his time to share his knowledge with us. Please remember to register for the next Pause and Learn webinars hosted by Dr. Kirsty Sexel on setting your new pet up for success and separation anxiety. If you'd like to learn more about PetSure, Gap Only, or the Pause and Learn webinar series, please follow us on social or visit our website. Good night, everyone, and thank you so much for attending.
Thank you very much, everyone.